Hello everyone and welcome to Inside Healthcare. March is Women's Health Month. So we begin this program by taking a look at the most common reasons women go seek emergency care. And we're pleased to, very pleased to have back with us Dr. Carolyn McLean with the Urgency Room Medical Director there. So thank you for being with us.
Yeah, thanks for having me.
So what would be some of those top reasons that women seek emergency care?
So the number one reason women come into the emergency room is abdominal pain.
Interesting. I wouldn't have thought that was at the top reason. Yeah.
Well, when you think about it, the abdomen has a lot of organs in it. So
it does.
It has your liver, your gallbladder, your appendix, your stomach, your uterus, your ovaries. A lot of things can go wrong. And people usually come right in because the pain's often very severe. Mm-hmm. So with women, one of the things we see more often with women than men is gallbladder problems. And that's 3 times more often in young women than men.
And it's just because of our anatomy? And
no, it's partly just the way we digest fat compared to men.
Oh, interesting.
So your gallbladder is a bag that helps you digest fat. And so what will happen when you have a gallbladder problem is right after you eat, you have sudden onset of incredibly severe pain.
And where would that be, localized, or is it all
Yeah, it is. And the hard part is that it's right underneath your ribs on the right side.
Okay.
So sometimes people will come in and call it chest pain because it's in your chest and your abdomen. So as you breathe up and down, you'll have pain when you breathe because as you move your diaphragm, you're moving that gallbladder. And the pain is incredibly severe, and it can suddenly go away if that stone dislodges itself from the gallbladder duct, mm-hmm. and then it can come back when you eat again.
Oh, so what do you offer them at the emergency room, or at the urgency room?
So first you have to diagnose it. So you have to find out what's causing the pain, and then there are options. Sometimes patients need surgery to get that gallbladder out.
The whole gallbladder?
The whole gallbladder. And you actually can live just fine
without it. Minimally invasive now too, right? You don't make these big incisions anymore.
Yeah, people do very well with this surgery. It just, sometimes you have to wait to do the surgery because when your gallbladder's inflamed, it's really big. It can be as big as a football, really big.
Wow.
And so you want to wait until they call it cooling off, but what that really means is getting back down to the size of a deck of cards or smaller, and that makes it really easy to take out through laparoscopic incisions instead of a big one.
And I understand with kidney stones too that that's a very common reason that men and women will seek emergency care.
Also sudden, severe pain.
And I hear it's as bad as having a baby. Some people have described it, yeah.
Yeah, and it will come on suddenly and go away suddenly. So that's it, but it's a significant amount of pain. So people will come in because they know something's wrong. And when you feel that much pain, you need to get into the urgency room.
And again, where would they be? In the front, in the back?
So you have 2 kidneys, one on both sides,
right.
And you'll feel it radiating from your back down into your pelvis.
Okay.
And it's really severe pain.
And again, you want to get some of that pain under control and then see if there's next steps to do it.
And in both cases, those stones can pass on their own, but they don't always.
Any advice that people can do to prevent these type of inflammations and stones and things?
So sure. So gallbladder stones can happen from eating fat. So if you decrease the amount of fat in your diet, that can help with gallbladder problems.
Okay.
Because your gallbladder helps you digest fat. And kidney stones, the most important thing is drinking lots of water. Because kidney stones are created when you're dehydrated. That doesn't mean that's when they're gonna drop and cause you the pain. So you could be out mowing your lawn in the summer and that kidney stone's formed. It sits in your kidney, then drops today, 8 months later, and that's when you pay back that dehydration day.
And I understand that there's if there's a family history of it, you're at a higher risk for getting those as well. Mm-hmm. Maybe regardless of dietary.
Absolutely, yeah.
So what would be some of those other top reasons that you have women coming to see you at the urgency room?
So lots of pregnancy-related complaints early in pregnancy. So unfortunately, most women who have been pregnant know that early in pregnancy you do throw up a lot, and you can get severely dehydrated. So when that happens, you come in, you get some fluids, and then you can get some nausea medicine, and it's really important that you don't get dehydrated early in pregnancy. We'll also see miscarriages, which are unbelievably sad, but any vaginal bleeding in pregnancy, you want to come in as well.
Other symptoms that you should be looking for, like why you should go see the emergency, seek emergency care?
Any abdominal cramping in pregnancy, you want to come in as well.
And don't wait to go see your doctor at the clinic or anything.
You should call your doctor, but if you can't get in right away, you should come into the emergency room.
Okay, it could be that serious.
Yeah.
Some of the other things that you're seeing?
I think, women also have break their ankles, and the one thing I see a lot is at a wedding. Women are wearing those strappy heels that they don't normally wear, and then they dance. Boom.
Oh my gosh.
I mean,
I wouldn't have thought about that at
every Sunday morning, there's somebody that was like, oh, I shouldn't have worn those shoes.
No.
So just keep that in mind.
They should come with a warning, dangerous for your health.
Yeah, and a lot of times you see that too with women walking into church because they're wearing heels, and it's slippery, as it was this past weekend, and you just slide. So just be very careful. That's unique to women that we wear those high heels and break our ankles.
Other top reasons that women come in?
We have as many allergic reactions as anyone else, and anytime you start getting hives or feel short of breath, you want to come right in to be seen because you don't know how quickly things will change.
And even if you haven't had it in the past, all of a sudden if you're having difficulty breathing, that's a reason to go see you.
And the frustrating thing about allergies is they can develop at any age. So you feel like, gosh, I'm 45, I should not have a new allergy, but allergies can develop at any age. You can suddenly become allergic to ibuprofen or suddenly become allergic to shrimp. So don't hesitate to come in if you develop any kind of rash, shortness of breath, lip swelling.
I had a friend already saying that she had to go get a shot because she was having some allergies already, spring allergies.
That's a good sign.
We've had some warmer. I know, but we have a couple of teasers with some warm days, but yeah, we still have our snow and ice and cold. And
Yep.
Other things that are really in particular just for women that you see?
So bladder infections are much more common in women, and it's almost exclusively women as we're younger. As we get older, men and women get bladder infections, but young women get bladder infections, and we see quite a bit of them because they're so painful and distracting, and you just need to get that taken care of as quickly as possible.
Anything we can be doing to reduce those bladder infections?
I think drinking lots of water, actually, cranberry juice is really good. If it's got real cranberries in it, that actually does help very early on. And then if you are going to wait to come in, there's a drug called Azo, which is over the counter, which can numb some of those symptoms up so your bladder doesn't spasm and you don't have the frequency and pain. That's a temporary fix. It doesn't fix the problem, but it does treat the symptoms. And that's an important thing to use while you're waiting to get in to see a provider.
Final comments for our viewers.
If you have any issues, anything you're worried about, the urgency room is open 8 to 10.
You have 3 locations?
3 locations, yep, Woodbury, Vadnais Heights, and Eagan.
Well, Dr. McLean, always a pleasure to have you with us. Thank you.
Yeah, thank you.
Really appreciate that. Still ahead, what's being done locally to prevent deadly overdoses. Stay with us.
Chris Domine is a husband, father, and athlete because a kidney transplant gave him a second chance at life, made possible by an organ donor. Imagine what you could make possible. Learn more and sign up as a donor. Go to organdonor.gov.
Recently, the White House convened a summit on the opioid crisis and announced that they're working on very strong policies to combat this epidemic. To tell us what's being done locally to save lives and prevent deadly overdoses, we're pleased to be joined by Randy Anderson with the Steve Rumler Hope Network. So thank you for being with us.
Well, thank you for having me today.
So before we begin kind of talking what you're doing locally, can you just tell us about the organization?
Yeah, so the Steve Rumler Hope Network was founded in 2011 by Judy and Bill Rumler after their son had died from a heroin overdose. They really, it was devastating for their family. 2 weeks after that, they started this organization in honor of Steve, and really in hopes, their main hope was that they could prevent one family from feeling the same pain that they'd felt. That was really that was really the heart of it, which I still think we do every day. And also the network's done some amazing things. Since 2011, they passed some laws in the state. Steve's Law, which allows all persons to carry naloxone. It provides some immunity too for those using or overdosing. They've helped reschedule some drugs at a national level to help prevent further overdoses. And they made one of the big things too that often is forgotten is we helped make sure every EMS carries naloxone in our state.
So that's a good starting point. So naloxone, can you tell us what it is, this medication? How is this helping to save lives?
Yeah, so naloxone, sometimes also known as Narcan, is a medication that acts in the brain. So an opioid overdose first occurs in the brain. So you have receptors in your brain. When you take opioids, those receptors get flooded, and then it essentially tells your lungs to stop breathing. Like it sends a signal. I know the breathing is an option now when you have too many opioids. So what the naloxone does is, however it's administered, goes and ends up in the brain, and it actually knocks the opioid off the receptor and blocks it, so the opioids can no longer get in there, and immediately can reverse the effects of an overdose.
And you have to get to the patient, the person who's overdosed, as within a certain 24 hours, 48
well,
hours?
so it's a short window. It can be depending on the type of drug or medication they've ingested or put into their body. It could be a quick. You only have 5 minutes sometimes to react. If it's not so deadly or strong, it could be 20 minutes, 30 minutes before a person would need attention, where you could still save their lives using naloxone or Narcan.
And how is it administered then?
So there's 3 ways. Two are the same. So intramuscular, so either in a large muscle, the outer thigh, the upper arm,
injection?
Like an injection. We do trainings where we load vials and show people how to work with needles. And we have some auto injectors, they're called. It's a device that speaks to you and tells you how to.
Wow, those are nice.
They're really nice, but they're really expensive. The drug manufacturers still make those, so they need to make money. And then the other way is through a nasal Narcan, which the first responders that carry Narcan, it's a nasal version that just goes up the nose, and it's a simple squeeze and it's done.
That can be
really simple, correct.
So you were saying that we have here in Minnesota, or in the Twin Cities, that we do have a lot of the emergency services that are equipped with this?
So, I mean, I don't have
responders?
the most recent numbers, but many police forces now are equipped with Narcan. All EMS, to our knowledge, in the state, every ambulance has naloxone or Narcan in it now, which didn't before, which surprised us. Fire departments, colleges, businesses, anyone really. We all partner with anyone. In fact, there's a small business in Golden Valley that's called U.S. Magnetics that they had an overdose in their parking lot. They called us one day and said, hey, what can we do? So we trained their employees, and they have a kit there.
So how do they know when someone is having an overdose?
So there's some telltale signs to look for. So the person is non-responsive. They won't wake up. You can scream, yell them, shake them. We talk about a sternal rub, where you actually take your knuckles and rub on their sternum. And if somebody doesn't wake up from that, it usually means they're in signs of an overdose, or bluish skin, usually the lips or the nails. They're making weird gurgling or gasping sounds. My friend calls it it's snoring and gargling at the same time, which is something you won't often hear. And so there's some of the signs you can tell from an opioid overdose.
And your network, then, you're doing a lot of training because it's valuable for anyone to be able to do this then?
So correct. So when we passed Steve's Law in 2011, that law said that all persons, no matter who you are, can carry Narcan or naloxone legally. And so we do anywhere from as few as 4 to as many as a dozen trainings per month, private and public. Treatment centers, hospitals, pharmacies, Anyone, anybody.
Anybody, organization,
anybody.
Household even, perhaps, yeah.
Yes, correct.
So what's involved with training?
So typically the training, so we have, if there's electronic media available, I have a PowerPoint I put up and I go through the statistics, like how many people die. We talk about what Narcan and naloxone is, how it acts in the body. We educate people on best practices, like making sure you stay safe with latex gloves we provide, or non-latex gloves. Breathing device barriers for offering rescue breaths. And then we give them some hands-on. We actually, in the IM or the intramuscular trainings, we show them how to load a needle through a vial. So we use water in vials, so there's no wasted naloxone. And then they inject into an orange, so they can at least know what that process is like. So it's a real hands-on part of it is, and a lot of it's education. We just continually educating.
It's not a CPR class.
No, we don't do, so we don't teach chest compressions. We talk about rescue breathing. We believe that that's an important part of this because oftentimes it's a respiratory arrest, so the person isn't breathing, which then eventually leads to low oxygen levels, which leads to cardiac arrest.
You know, and this is a very serious problem, not only around the country, but even here in the Minnesota area as well. You said that on a daily basis we still have a number of people.
So yeah, in Minnesota, as bad as it is, we're still like 38th in the country. However, we're still losing about 2 people every day to overdoses. And opioid related, almost 1.5 of those are. So it's a large number of just related to opioids. So in Hennepin County, they've had a 50% increase in 2 years in opioid related deaths, just in Hennepin County.
So if anyone is interested in the training sessions, you have a website?
So yeah, SteveRemoteHopeNetwork.org, or you can go to, if you're on social media, Facebook, we list all of our events on social media, and you can simply just go to the event, click I'm going, and that's your RSVP.
And you have events coming up, and they're all over.
So we are targeting Washington County a little bit right now because we received some grant money from the state, and Washington County was identified as a state that had higher needs. So we have 4 trainings specifically coming up soon in Washington County, but they're all over the state.
Well, Randy, great to have you on, and great information for our viewers.
Thank you. Thank you so much.
And good luck with everything. Yeah.
Thank you.
Thanks. Still ahead, you're never too old to improve your health and well-being, but up next, a dramatic rescue on the streets of downtown St. Paul. Stay with us.
Chiru has no choice. She and millions like her walk miles a day for dirty water. Together, we can end their walk by providing clean water. Because when you just add water, you change a life. Learn more at worldvision.org.
John Nassoff, whose parents were poor immigrants, grew up with a dream of making his home of St. Paul, Minnesota, a better place to live, and he did just that during his lifetime. Before his recent death at the age of 94, John left a philanthropic legacy that has touched countless lives, impacted future generations, and supported numerous local charities and nonprofit organizations like the St. Paul Firefighters Foundation. In honor of John Nassoff, we thought that you would like to see a short video we produced about some amazing firefighters who received the last John Nassoff Firefighters of the Year award. These guys brought a man back to life in a dramatic rescue right on the streets of downtown St. Paul, not far from where John Nassoff grew up and where he lived almost his entire life.
In my 34 years, that's the first time I'd ever seen that done before.
One of those things you just said, oh, wow, I just did that.
I was driving the medic rig that day, so it was myself, my normal partner, Jeremy Coy, and then we had our student, Doran Bishop, in the back.
I happened to be here at 8's that day, and that's when everything happened.
In front of the door today, and we noticed that there's a gentleman on the ground, pale, and there's St. Paul police officers doing CPR. We get out of the ambulance, take over CPR from the police officers so they can handle the scene.
I think I had come back from medic school that day, and when we arrived on scene, we found them with this individual who was on the ground. His face was purple.
He wasn't breathing, so we knew we had to get an airway in at some point, and usually we would go into the trachea with an endotracheal tube, but his his mouth was just full of so much food. We were getting nowhere with our suction devices.
This person's airway has been obstructed, for we don't know how long, and after 4 to 6 minutes, if we're not getting oxygen to the brain, it can cause some serious damage.
We had to perform a cric to save this, or at least attempt to save this patient's life.
The procedure itself is pretty rare. Some medics will go a lifetime and never do them. Doing it on the street where we were, probably even more so rare. They said they're still not able to get any air through it. So at that time I said, we probably need to do a cric on him. But there were, 50, 60 people watching what was going on as traffic's going by too. So it was literally right out in the open that this was being done.
When they saw this little scalpel come out there, everybody kind of stepped back.
You just take a scalpel and you cut down, and then once you're down through the tissue, there's a little membrane in there, and you just kind of poke the scalpel through that, and then you kind of go side to side, kind of open it up a little bit. So basically you're inside their windpipe.
After we made the incision, I used the sclar hook to grab the patient's trachea and open it up so that he could slide the breathing tube down his throat.
As soon as that happened, I began managing the airway after the tube was actually placed. So I began bagging the patient, beginning to get his oxygen sats up.
Together they did a really good job. It was, not a lot of blood. There was no complications. It just went off without a hitch, just like we're trained to do.
And that's the first time that I'd ever seen anything like that. It's something you hear about in the movies or on television or whatever, never actually seen it done, and it just went like clockwork.
Extremely proud of those guys. And everybody there, from the police on down. I mean, everybody did what had to be done to save that guy's life.
As soon as we got, the cric in, he had a good rhythm again.
We had a good blood pressure, his O2 sats were good, but he still wasn't breathing on his own.
Maybe not his life, but somebody else's life.
Welcome back to Inside Healthcare. Finally, joining us now is Mark Skye to tell us about the Vital Aging Network. So thank you, Mark, for being with us.
Thank you for having me.
What's the Vital Aging Network all about, and what's your purpose?
The Vital Aging Network is an organization of volunteers. The purpose of the organization is really around self-determination, civic engagement, and personal growth as people as they age. We do this through a variety of education offerings, and we do it really across the state of Minnesota, but we're really focused within the metropolitan area.
And why have it? Why have this organization?
Well, the organization really focuses on the objectives, and I'm a retired 3M'er, and there are many of us who come out of retirement and saying, what's next in life? What do you do next? In terms of, there are a lot of volunteer opportunities in terms of how do you move forward. We always talk about the peeling the carrots and stuffing the envelopes process, but there's other ways you can really engage. And one of the ways that most people really want to engage is they want to use their own personal talents, they want to use their skills, they want to be able to make a difference, not only with themselves, but in the communities in which they live.
And that can keep you healthy in the process.
Absolutely, right. We've got a program called Evolve, Reigniting Self and Community, and that program has really been going on since 2003. And the Vital Aging Network was founded in 2001, so the program has really been since almost the concept of the Vital Aging Network coming in place. A spin-off of that Vital Aging Network program is a program which we call Wellness 50 Plus. And it's a program which we were funded initially by the Bush Foundation on a community innovation grant with help and some mentoring from the Health Partners organization. We ran that for 4 years. We just completed what we call the alpha phase of that pilot program, the beginning stages, and we did it in 4 communities across the state. We did it in Alexandria, Minnesota. We did it in the Phillips neighborhood in South Minneapolis. We did it to set up a community in the Midway, the Hamlin Midway area, and then in Oakdale.
Okay.
And all 4 communities really are grassroots volunteer organizations, volunteer teams, which are really bringing health and wellness to the community. And it's really successful. I mean, the people in the community is really engaged. They got really behind it. And they all went their own separate ways. It's really kind of unique to watch them work as a team, and as the team formed together, and as they went forward. The success of that program really led to another opportunity, really led to working with Washington County Department of Health. And Washington County Department of Health, with some assistance from Health East, Health Partners, and Alina, along with the people from the Department of Health, really now are looking at expanding that into 4 additional communities across Washington County. So within this spring, we are in the process now of recruiting team members for Forest Lake, Minnesota, Stillwater, Minnesota, Woodbury, and Cottage Grove. So we are in the process now of putting the program together. We hope to launch the program yet sometimes late this spring, and we are in the process of recruiting team members for that program. So the program really will consist of really going through some training, and really we talk about identifying who are the stakeholders around wellness in your community, who are the people that are most impacted around the process, then working really in the community to drive it to the individuals. It's not about the top-down approach. Oftentimes when you look around wellness programs that come out of the hospitals or come out of the clinics, they're often telling us what to do. What we're really turning this around and really looking at it from another, actually turning the pyramid upside down, where the people in the community really go in to try to understand what are the needs of my community. And we really focus on 4 different areas. We focus on being physically active. We focus on being eating right and eating healthy. We focus on being a healthy mind and keeping your mind engaged.
Reducing stress.
Reducing stress and all the other things that come along with that. And the thing that we also look at is coping and healing, and as people move through aging, taking care of themselves, going to the doctors, getting your regular physicals, doing the things that you need to do. But those 4 areas, that's one thing we do within the Vital Aging Network, is we realize we've got within the country, we got such a wealth of talent and such a wealth of skills, and the difficulty is oftentimes they're really not used. You know, people really way too many people are sitting at home watching TV, playing bingo, doing things, and where they really they could be engaged. An opportunity. And one of the things that really comes together with these teams is they really come together. It's really great. The Oakdale team has really done some remarkable activities.
Mark, I'm afraid we're out of town. We'll have to have you come back another time so we can get some more information about some of these great programs. If they have information, go to your website.
Go to my website, vitalagingnetwork.org, and you can reach us there, and we can move on from there. Very good.
Sounds
Look
great.
forward to hearing from you.
Thanks, Mark.
Good.
Thank you. Appreciate it.
Appreciate it.
And we'd like to thank you for joining us. Thank you for joining us, and we hope you can join us next time on Inside Healthcare. See you then, everyone.